Good morning, everyone. I'm going to kick off today's webinar. My name is Bill Ghali. I'm the Vice President Research here at the University of Calgary. And it's my pleasure to be the moderator for this webinar focused on vaccination for COVID-19. We have pulled together through our Office of Advancement and the 19 to 0 initiative that you'll hear about in a minute. We have pulled together a distinguished panel of speakers, and it's going to be my pleasure to introduce them in a moment. Before beginning, though, I would like to acknowledge that we are on the lands of the Treaty 7 First Nations here in the Calgary region, and this is also home to the Métis Nation of Alberta, Region 3. And we make those Indigenous land acknowledgements in a month where we have learned, I think all Canadians have learned a bit more about our history of residential schools in Canada and the discoveries, plural, in both Kamloops and Brandon, Manitoba, remind us of that history and expand our knowledge of that history. And this is part of our needing to take a journey of truth and reconciliation in keeping with our University of Calgary strategy for Indigenous engagement and Indigenous partnerships at Tapatope. So as we make our Indigenous land acknowledgement today, we want to just reflect a little more deeply on what we've been reminded of and learned of in the last couple of weeks. Today's webinar, as I said at the outset, is being hosted by the University of Calgary and 19 to 0. And 19 to 0 is an organization designed to share the latest medical information relating to vaccination for COVID-19. And here with us today, we have Dr. Jia Hu and Dr. Cora Constantinescu, as well as two deans, distinguished deans from our university here, Dr. Sandra Davidson, who is our Dean of the Faculty of Nursing, and Dr. Jon Meddings, who is our Dean of the Cummings School of Medicine. And we are going to have our event today as a fairly informal exchange where each panelist will address you as an audience and share some opening perspectives, and then we will get into a Q&A where we have some questions that were submitted ahead of time. And then there's going to be, I think, a substantial opportunity for audience interaction. I just want to say a little bit more about each of the panelists, and then we'll get into the content. Dr. Jia Hu is a public health physician and a primary care physician, and he has been a significant leader in our primary care vaccine rollout here in Alberta. He's a clinical assistant professor at the University of Calgary, and he is the chair and co-founder of 19 to 0, and I will let him say a little bit more about that. He's also a member of the O'Brien Institute for Public Health in the Cummings School of Medicine. Dr. Hu works at the East Calgary Health Centre, and that is an inner city family medicine practice that serves socially vulnerable populations. He's also the corporate medical director with the Canadian Pension Plan Investment Board with Cleveland Clinic Canada, and he's previously worked in a consulting role with McKinsey. And Dr. Hu has advised governments on health financing models. Cora Constantinescu, our colleague, is a practicing pediatric infectious diseases physician who had a busy clinic this morning. So thank you, Cora, for scrambling. One of the areas that Cora works in is seeing vaccine hesitant patients in clinic, and she spends time talking to patients in the pediatric context and families, talking about vaccines and why we have vaccines, and trying to address concerns there. She holds a medical educator appointment here with the University of Calgary, and she is actively involved in developing curricula and educational programs that are rooted in psychosocial determinants of behavioral change. Like Jia, she is co-lead of 19 to 0. and Dr. Constantinescu. I'm going to call you Cora. Everybody's going to go on a first name basis in a minute. She has been on television frequently throughout the pandemic, CBC in particular, addressing questions about COVID-19 vaccines. Sandra Davidson. Sandra is our Dean of the Faculty of Nursing. We are so lucky to have Sandra in our midst. All you have to do is Google her and see what a national, international leader she is. She has been at the University of Lethbridge, University of Alberta, at Arizona State University, and now at the University of Calgary. And she has a number of distinguished awards, and I'll just mention the Canadian Nursing Association's Order of Merit, the Canadian Association of Schools of Nursing Award of Excellence in Teaching and Curriculum Development, among many others. A Career Virtuoso Award. I love the name of that award. Anyways, we're very proud of Sandra, and she's also involved in 19 to 0. And then last but not least, I'll introduce my friend and former boss, Dr. Jon Meddings, Dean in the Cummings School of Medicine. Jon is a very distinguished scholar and has been a leader. He has had periods of leadership roles at the University of Alberta, where he was the head of the Department of Medicine before becoming a vice dean here at the University of Calgary. He served a period of time in the vice president research office here at the University of Calgary, and now the dean of the Cummings School of Medicine, leading us through an incredible period of transformation. And among other things, he is a gastroenterologist, and if you get him at the right moment, he will tell you hybrid gastroenterology dad jokes that make me laugh very, very much. Not everybody laughs, though, Jon. So with that opening, I will turn our attention now to the panel. And what we want to do here is shed light on vaccines and the swirling information on vaccines. And I'll say that we are in an unprecedented time where we have the convergence of a global pandemic that has been devastating on multiple levels, obviously in terms of health effects, economic effects, mental health effects, among others. And we're at an unprecedented time where there's been the sudden rapid development of multiple vaccines and fast-moving information on all the vaccines. Historically, single diseases, infectious diseases have had one vaccine, and then several years later, another vaccine comes along. Here we have all the vaccines that we have to think about, the swirling information, the timing interval questions, the emerging information on adverse effects that are reported through post-vaccine surveillance. So it's a confusing time for the world and the general public, and you are experts who can share your knowledge and talk about vaccines with the ultimate reality. And the University of Calgary is not being shy about this. The University of Calgary recommends, without reservation, broad vaccination for COVID-19 to protect yourselves, to protect your neighbors, to protect your loved ones, and to ultimately control this global pandemic. So that is an opening salvo, an opening statement about the University of Calgary position on vaccines. We, of course, want to answer everybody's questions, and that's why we have these experts. So with that, I'm going to turn to each panelist for some opening comments. And I'll begin with Jia as co-lead and founding lead of 19 to 0. Over to you.
Great. Thanks for the introductions, Bill, and thanks everybody for making the time, 11 a.m. on Tuesday, to come listen to this. You know, I over the last, since January, I guess I really have, COVID has really consumed my life, but I think the pandemic is really affecting everybody, right? You know, public health has asked people to do, well, everybody to do something, right? So over Christmas, it was like not seeing your loved ones over the holidays, which I think was very difficult. You know, many people have been really, really, really adversely affected, but no one's been untouched. And once again, I think we're asking everybody to do something, which is to get a vaccine. And this is sort of where 19 to 0 comes in, right? So, we're asking society to do, everybody in society to do something. So 19 to 0 really, fundamentally exists to, I think, close the gap between the people who aren't vaccinated, people who are, so that everyone gets vaccinated. And it pulls together organizations like the universities, like academia, like public health, folks like me, like healthcare folks like Cora, but also members from the private sector and civil society organizations and NGOs and governments and everybody, because I think we need an all of society response. We do a lot of work with healthcare workers. We do a lot of work on the sort of social media analytics on the fight misinformation side. But I think maybe the most important thing we do actually is engage with and connect organizations that sort of serve and are embedded in the community, because that sort of makes up the fabric of society. We've done hundreds of these town halls, but I view them as one of the most critical things we do, because as Dr. Ghali was saying, it's pretty hard to understand what's going on with the vaccine stuff, the headlines flowing, hither and thither. And, I really view one of our core jobs is to make sure that people are educated and informed about vaccines so they can make, the right decision about whether or not to get them. And, mark my words, these vaccines are highly, highly effective, highly, highly safe. It's, at this point, we have a vaccine that works incredibly well, or a series of vaccines that work incredibly well, which is frankly, I'll call it the miracle of modern science, to use a sort of a catchphrase. And we now actually have enough of those vaccines in Canada to really immunize everybody, with the recent government announcements of Moderna coming in, Pfizer ramping up, and all those things. But the most important, the last step, is that getting those vaccines into people's arms. And there are plenty of people who don't want to be vaccinated yet for various reasons. And our job is to sort of address people's concerns and questions and make it as easy as possible for people to get vaccinated. So thank you for coming. Thank you for listening. And I'll hand it over to Dr. Cora Constantinescu.
Okay, so Cora, over to you. You've had a chance to take a breath after clinic.
Yeah. So thank you for having me. I think it's a really timely moment for the UFC to be doing this, and I'll tell you why. You hear a lot of people say this has been a hard year, and it's definitely been a hard year on a lot of us. And but I also, as a pediatrician, want to point out that even for those people and those the kids in our society for whom this has not maybe been the same kind of personal threat as for older adults and for adults, it's been a really hard year in terms of mental health, in terms of lost socialization and education. And I want to share with you a few personal stories. So this last year that has been so emotional, there have been a few moments where I felt completely overwhelmed by the anxiety of it all, and by the weight of it all. The first time that happened was when I was there was a first lockdown, and I was driving to work, and the eerie silence around and how incredibly quiet it was this overwhelming moment. The other overwhelming moment was when I actually had COVID, again, a very anxious time. And then the last, and when I had the same reaction, was when the initial announcements about the mRNA vaccine efficacy came out. And we found out that not only are they effective, they were incredibly effective, around the 90 to 95% range. And there was a lot of emotion with all of these. And over the last year, all my work in research and advocacy and education has been around this COVID-19 and COVID-19 vaccine. And I spent a lot of time educating myself on this as well. And it's kind of been incredible, because unlike any other time, this is something that everybody, every healthcare worker I know has had to talk about or consider, and similarly with so many Canadians too. And we had a slow start in Canada on the vaccine rollout, but boy, how well we've done. And Canada chose vaccines very well and very wisely. And look at the vaccine confidence wave that we are riding right now. So many Canadians have done so well. They've come forward, they took control of their own protection by getting the vaccine, and they looked out for their neighbors by taking this vaccine. So I want to say thank you to you all who've gone on and had the vaccine. And for those of you who haven't, thank you for being here and bringing in your questions and your concerns. And I hope we can address some of those. And I'm really looking forward to the conversation today.
Thank you, Cora. And I just wanted to just a point of a question for clarification. So when you say mRNA vaccines, just for our audience, you are referring specifically to which ones?
The Pfizer and the Moderna vaccines. And when we talk about the viral vector vaccines, we'll talk about the AstraZeneca and the Johnson & Johnson vaccines, which are the 4 vaccines right now authorized in Canada. And if there are questions, we can talk about the pipelines of authorization and what would come up next.
Perfect, thank you. Okay, so let's go over to Sandra now for your opening comments.
Thanks so much, Bill. And Cora, I echo your comments about thanking everyone in the audience for being here. The fact that you're here coming with your questions and legitimate concerns, and hopefully we can shed some light, is just amazing. I've been involved in 19 to 0 since Jia asked me in December to be a part of this journey. And of course, as a nurse, even though I'm more on the academic side and don't practice clinically, I am a nurse. I am a registered nurse, and this is, as we've all said, this is important to all nurses and all healthcare providers that want to see us get back to normal, and the path back to that is the highest possible amount of vaccine uptake that we can achieve. And so we've had a lot of involvement with our faculty of nursing. It's been great learning for our nursing students really to understand this and be a part of moving the needle, as they say, no pun intended, in vaccine hesitancy and being part of vaccine clinics. We do have a professional obligation through our code of ethics to not put our those we care for and our communities at risk. And part of that is being champions as nurses and getting the vaccine ourselves and having clarifying conversations, providing best evidence to people that have questions so that they can make an informed choice. And so again, with your opening comments, Bill, about the university heartily endorsing and really wanting to make sure that everybody that wants a vaccine can get a vaccine, and to do that sooner than later, I'm here to support that. And if you have questions, I would offer you, we were on a 19 to 0 call the other day, and, we literally have pharmacists and public health experts and nurses and physicians from across the country who are ready, willing, and able and want to have these conversations with you. So please reach out to any healthcare provider, really, with whatever questions you have that perhaps we're not able to get to today. And again, thanks for being here.
Thanks, Sandra. And then last but not least, we'll go to Jon, asking him, how many gastroenterologists do you need to change a light bulb or administer a vaccine? Jon.
You don't want to know the answer to that, Dr. Ghali. So I, on behalf of the Cummings School of Medicine, I'd like to welcome everybody here and say thank you for coming, echo the comments that have come up. It's interesting when I reflect on this a little bit and think a little bit about the history of healthcare. There have been things in the past several hundred years that have saved lives. The things that have saved the most lives have been clean water, sanitation, and vaccines. Vaccines are not new. We've used them for many diseases, and for viral diseases, they are a mainstay for us to save lives. So I think it's critical that we all understand this. We are in I think Jia talked about this a little bit, we're in a glorious time. We don't have one vaccine for COVID-19. We have a plethora of vaccines, and that leads to lots of questions that's important to answer. I think one of the things that's been pretty apparent is that not only do we have a plethora of vaccines, we have a plethora of misinformation about vaccines recently, and hopefully that we can address some of that and put some of that to rest. And secondly, we actually have a misperception that I just want to spend 2 seconds on, and that misperception is that vaccines are a personal choice because they protect you as a person. And that is a misperception that I think is important to get rid of a little bit. Vaccines do a whole lot more than protect just you as a person. We know that there are people in our society who will be vaccinated who will not receive any benefit from their vaccine for a variety of reasons. And I have a personal interest in this because my wife suffers from a disease called multiple myeloma. And patients with multiple myeloma who receive the COVID vaccine, a significant fraction do not form antibodies or do not form an immune response. And so the protection for those individuals is provided not by the vaccines that they get, but by the vaccines that all the rest of us get. And so it's critical for all of us that we do this, not just for ourselves, not just for our parents, not just for our kids, but for everybody else in society. Vaccines are public good as well as a personal good. And it's just important, I think, that we all reflect on that. Thanks, Bill.
Okay, so tremendous opening comments to set the stage. And what I will do now is begin to bring forward questions. And we had a modest number of pre-submitted questions, and then we can use the Q&A. You all have access to the Q&A function and can begin to contribute questions there as well. So the first question I'm going to ask is directed to Jia, and this relates to the vaccine development process. Some people have expressed concern that these vaccines were created way too fast and approved too quickly, and they worry that the vaccines are therefore not safe because of the speed at which they've been developed. Jia, can you describe the COVID vaccine development pipeline just at a general level and the approval process that they had to go through?
Yeah, so I mean, I think it's important to realize that like no steps were skipped in the vaccine development process. All the sort of safety standards, regulations, guidances were followed. I mean, where do we start? We start with the fact that the technology to make mRNA vaccines, viral vector vaccines, have been researched for decades. Had we not been doing that, we wouldn't have one so quickly. So we're building on a base of something. And then you enter a few different phases of the clinical trials. Your first phase just looks at your safety in healthy people. Your second phase looks at the immune response. And your third phase is where you have the big clinical trials. And, you know, for phase 1 and 2, very good, same as any other vaccine. And for phase 3, we'll say that the vaccines were approved by Health Canada, the FDA, the European Medicines Agency, on an emergency use authorization, generally speaking, because the need to prove them was so great. But again, the extent to which vaccine safety is scrutinized is unbelievable, right? So not only do you have these studies, you literally have a sort of post-marketing surveillance system after the vaccines have been given that looks for safety signals in every single person who's gotten a vaccine, not just in Canada, but all over the world. And that's billions of people at this point. And, you know, even with the best run studies, stuff you trust, right? Any medication you take, nothing has been as scrutinized and as studies as much as these vaccines have been today. You know, I often talk about how confusing the recommendations have been around, say, the AstraZeneca vaccine from, you know, the National Advisory Committee Organization. And, you know, if they're willing to suspend a vaccine for very, very, very rare side effects, it goes to show how obsessed these regulators are with safety. They think of nothing else. That is their job. Now, going back to a higher level, you know, I think about sort of the things that people have been able to do. Like we said, you know, we did send somebody to the moon in 1969, and that entire NASA program probably had less computing power on like in all of it than like your cell phone does today. And when we really sort of put our minds to it, you know, when you have all the world's best scientists, when you have billions of dollars of resources pouring in, we can do amazing things. And we had to, and we did for the vaccine. But know that there is nothing, you know, things may emerge, but we'll find them around the safety signals. But right now, today, they're super safe, super effective, and no steps in safety were skipped at all.
Okay, thank you. And maybe I'll just pick up on that answer on the issue about the surveillance and the post-marketing surveillance now where these are being given, and post-administration surveillance. We of course hear a tremendous amount about side effects, and there's never been a moment in history where there's daily news coverage on the adverse effects of the measles vaccine and the measles, mumps, rubella, and the tetanus shot. And so do you have a comment about the hypervigilance and the rapid spread of the communications about adverse effects that have people thinking these vaccines are perhaps, are these more dangerous than other vaccines? Or is it just that there's so much information out there now in the new information age? So perhaps Jia first, and anyone else can jump in on answering this question.
Yeah, I mean, I do think we're living in a very sort of different era in a way, right? If I sort of go back to like the 60s, the 70s, when a lot of our sort of core vaccines were developed, that was a time when people really did trust science, right? And I mean, there's like two threads. There's the rapid flow of accurate information, and it's very hard to interpret that accurate information. When a vaccine gets suspended, even temporarily, you read the headlines, you're like, oh my God, I shouldn't get this vaccine. And that's a very natural response. And that's why we're here to answer questions. But then there's also the flow of misinformation, right? And you look down south, United States, you know, like very few Americans want to get the vaccine. Most of them are Republican, actually, not to diss Republicans. I like Republicans, many of them. But, you know, through things like Facebook and just sort of like a general alignment, like against sort of science, you begin to see more of this propagating. And we're in a bit of a perfect storm for this. I mean, in a way, we have benefited quite a lot. You know, one of the saving graces of our vaccine uptake rate, the wave of confidence Cora alludes to, is the fact that we've had a ton of cases. You know, you look at other countries, Hong Kong, Australia, better controlled, far fewer people get the vaccine there. And that's sort of a shame because, you know, every day, you know, most people get their kids their childhood vaccinations without thinking about them at all. But there's been so much information, so much scrutiny, people talk about it. And that's why this fake stuff has spread so much and so much concern has spread. And I'll like, and you know, I'm curious to hear what the other panelists think about this, but it makes the job tougher, but you know, that's why you're here and that's why we're here.
Yeah, just to amplify one little point you make, we certainly, the early life vaccines that we give to our neonates are something that have just, people haven't talked about those as much. And so certainly the attention on the COVID vaccines is unprecedented. We also take our pets for quote unquote shots. So we do that without too much hesitation, just as a point that you just made. Any other comments on the information age, or should I move on to our next question? Nobody's unmuting, so there's one more in the adverse effects category, and perhaps I'll direct this one to Cora. There has been a lot in the media about the AstraZeneca vaccine and also Johnson & Johnson about the blood clotting condition and the vaccine-induced thrombocytopenia syndrome. Do you have any comment on that adverse effect? And then the extension of that question, because some comments in the Q&A are coming in, any recommendations around the mix and match option that we now have in Alberta, as many people received the AstraZeneca shot, and people are wondering what they should do with their second shot. Cora? Yeah, so this has been, this rare but very significant blood clot, whereby it happens in the setting of low platelets. So it's not just a blood clot, it's a blood clot that can affect significant blood vessels in the setting of having low platelets. It's its own phenomenon. That has been found to be associated with the viral vector vaccines, the AstraZeneca and the Johnson & Johnson vaccines. The numbers are still about 1 in 50,000 to 1 in maybe 100,000 on the first dose. Seems to be less common on the second dose, about 1 in 500,000 to 600,000. But there have also been fewer second doses. So it's always tough to come up with an exact comparison of numbers when there haven't been the same numbers of doses being given as the first and second dose. People who've had the viral vector vaccines without any of these reactions have made the right choice, because even in knowing this is a side effect, when you put the risk of this side effect versus the risk of death, hospitalization, severe disease, in that third wave, the risk of actual COVID disease itself was a lot higher than the risk of these of the side effect. However, we're in a privileged situation because we have more than one vaccine type that has been authorized and available to us. And the mRNA vaccines have not been associated with the same kind of phenomenon, which is why there've been so many changing recommendations. And most recently,
many provinces, so NACI and many provinces came out and said, instead of having a first dose of AstraZeneca or Johnson & Johnson, they actually recommend having a first dose of an mRNA vaccine because we have the ability to choose a different vaccine that's not associated with this kind of a side effect. If we didn't have an mRNA vaccine, I think we would all get the viral vector vaccines because there's still a net benefit to them. The mix and match has been interesting. So early on, people postulated that if you have one type of a vaccine and then you follow it with a different type of a vaccine, then you're not just stimulating your antibody production, but you're also stimulating other parts of your immune system like T cells, which can actually decrease severity of the disease, or they can actually kill the virus itself as opposed to just preventing the virus from getting into cells. So there was a bit of, immunology experts said there might be something here about mixing and matching. And then since then we've had a number of studies. Now they're much smaller studies at the initial phase 3, big clinical trials. That they have come up and said, actually, it does seem that if you have an AstraZeneca vaccine followed by an mRNA vaccine, you do seem to have very good protection, like good immune response, at the cost of having slightly more short-term side effects. So you're getting a very brisk immune response, but you're also more likely to have a sore arm, a fever, maybe aches and pain, chills and body aches that could be associated with that kind of mix. What's really interesting is just as of last week, there was a German press release that said they had actually looked at 250 people who had this kind of combination. And if you have the combination of AstraZeneca plus an mRNA vaccine, you don't just have more antibodies, but you seem to have better immune function. Speaking to that initial, hypothesis that the immunologists were putting forward, you have better function of your antibodies, better T cell response in those people who had this mix and match than in people who had 2 doses of the same vaccine, which is interesting. Again, numbers are somewhat small, and we cannot make the same big conclusions like we could when you study 40,000 people, obviously, but there's enough biological possibility there. And now, showing there's enough science to show that this mixing of vaccines does indeed seem to be good from an immune system perspective, which is why you've seen many people, many provinces made the recommendation that you could go ahead and have an AstraZeneca as your second shot, but then you can also have an mRNA vaccine.
Okay, so just paraphrasing that, I think we're hearing from you, Cora, a very helpful answer that for people who have received the AstraZeneca vaccine, there's certainly potentially a safety advantage and even an immunological advantage to switching over to one of the Moderna vaccines, which are one of the mRNA vaccines, which include Moderna and Pfizer. So thank you for that. We have received a question that's coming up in the chat and also in pre-submitted questions about what you tell, and this is to you, Cora, again, what you would tell people who are pregnant about vaccination. Is it safe? Does it threaten pregnancy? Are there special concerns in pregnancy? And then what you're telling families with young children about the considerations about their children. So can you comment? I know that's a lot.
I'll take them one at a time.
Yes, okay, go ahead.
Okay, so the pregnancy is very interesting because, when Jia was telling you that these were large studies, no steps were skipped from a safety perspective. The only thing that was skipped was that they didn't have the same kind of special populations included. Special populations meaning that the initial clinical trials did not include pregnant women, did not include children. So we were left to make some recommendation to protect these populations, but the studies were not there right off the bat. But now we're in a different position. And the reason we're in a different position, especially around pregnant women, is that we know that COVID, the disease, is terrible. to pregnant women. If you're a pregnant woman and you have COVID, you have 22 times higher likelihood of death than if you're a pregnant woman without COVID. That's a significant threat to a young, healthy woman. And we've seen a wave of ICU admissions in pregnant women in this third wave. So we know there is a clear benefit to the mom, and this is where it gets super exciting, and I could go on forever. Now they've shown some case reports that some of this immune response gets passed on to the baby. So those babies who are at high risk of infection in the first 12 months and severe infection, they can actually get some protection from the pregnant mom if the pregnant mom gets the vaccine. So definite benefit. Now, where's the safety at? So this is all publicly available data. You can just Google Centers for Disease Control and Pregnancy and COVID-19 vaccine, you'll get this. Over 120,000 pregnant women have had the COVID vaccine. That's a huge number. And when they looked at pregnant with a vaccine and pregnant without the vaccine, when they compared them to similar groups, they didn't see any more increase in any side effects like miscarriage or bad pregnancy outcomes in the ones who had the vaccine. So very reassuring that the side effects seem to be the same between whether you're pregnant with vaccine versus unvaccinated. Of those, 5,000 women are followed by something called V-Safe, which is a much more kind of active surveillance around them, asking them questions following their pregnancies. And then recently, just about, I think 2 weeks ago, a study was published that actually looked at the placentas. They looked at the placentas of vaccinated and unvaccinated pregnant women. And those ones that had been, and there had been no difference in the placentas. There was nothing wrong or any bad effect on the placentas of pregnant women. Again, showing that this is a safe vaccine during pregnancy, and the net benefit is huge to having this vaccine while pregnant, to both mom, and now we're getting some inklings to the baby. The kids' vaccines, again, not a lot of children, some 16 and 17-year-olds included, but not a lot of children. 2 companies, so both mRNA vaccines, have come out with studies on kids. Pfizer had about 2,300 kids, 12 to 15, and Moderna had about 3,700. So just around 6,000 kids included in these trials. Very brisk immune response. There's something really magical about teenager immune response. They have really good response to the vaccine with similar, but maybe slightly more short-term side effects. So for example, adults about 7 to 8 in 10 will get a sore arm, but 9 out of 10 kids had a sore arm. So just these kind of local, these short-term effects seem to be a bit more in kids, but incredibly good immune response. And based on those trials and based on the hundreds and millions of people who had these vaccines worldwide, these vaccines were authorized in children 12 and older. The 12 and under studies are underway, but they haven't been released yet. And what's important in those studies is to clarify a few things. Do kids need a second dose? What interval should they have a second dose at? And what dose should they get? So do they get the same dose as adults or smaller doses? And actually, it's going to likely be a smaller dose in kids 12 and under, because that's the cutoff in pediatrics, where we no longer say you're not the size of an adult, therefore you have to have a different dosage. So more to come on kids 12 and under. A lot of these studies underway. We suspect by fall we'll be able to tell you more about them.
Thank you for detailed answer. And I was just going to pick up one little piece that goes back to what Jon said. And actually, I see, Jon, you've unmuted, that one of the pieces about vaccinating children is also the reservoir of infection, where there can be population-based protection as more children are vaccinated. The illness itself is a little milder, or is a fair bit milder in children than it is in adults, but not without concern. There are some very sick children as well, and Cora will attest to that. Jon, you've unmuted. Anything to add?
I was just going to add just a little to Cora's unbelievably excellent explanation. The other concern that I've certainly heard raised to me is the question of infertility following vaccination, and I just wanted to dispel that quickly. First of all, it's, once you start vaccinating large populations, it is not unlikely that you are going to see common events occur after vaccination. Every major medical center has infertility clinics because infertility is a common problem. So seeing people attend an infertility clinic after a vaccination is not surprising. What is apparent, though, is that, first of all, is that there has been no clear evidence of infertility following any of the vaccines right now. And people have said, though, but that's because there's no great studies looking at it. And to some extent in the past that had been true. But as Cora points out, that now we now have studies looking at children. We actually now have studies of fertility in infertility clinics, and people who have difficulties getting pregnant, being either vaccinated or not vaccinated, there is no difference in any of the outcomes. So I think it's clear, this has been brought up. There was not a lot of rationale for bringing it up in many ways, but this in fact has been dispelled as well. No.
Okay, thank you, John. That's useful add-on. I'd like to direct this next question to Sandra, and then others can chime in. And it relates to a question that's coming. So interrelated questions. One is, if people have had a single dose, is that enough? I don't like getting the sore arm. Do I really need a second dose? That's question one. And then the second is, if I've had COVID, do I really need to get vaccinated? So Sandra, why don't you start on either of those, and then we can bounce the ball around to others.
Sure. Thanks, Bill. And thanks for the question. And I would say the short answer is yes to all of it. You do need a second dose. Varying reasons, and I'll just highlight some of my thoughts, and then I'll let others chime in. Many of you on the line will have heard about the variants of concern and the mutations that are happening with the COVID vaccine the longer we're in the pandemic. And what we're finding is, as we have more evidence, is that where we initially thought that one dose offers some protection, one dose isn't as effective with the variants of concern. So when we're looking at things like the threatening of perhaps a fourth wave, because we have the Delta variant that has mutated, and we're really starting to see that 2 full doses of whatever vaccines, whether it's the AstraZeneca and Pfizer, the mixing and matching, whatever you choose, that you have better protection. We all have better protection if we have 2 full doses with those variants of concern. And the challenge is, if we have the majority of the population that just has the 1 shot, and we see an uptick in the number of Delta variants, that is of concern that we won't have as much protection as that we need to mitigate that 4th wave possibly. So that's 2 absolutely is better than 1. Double your fun, as the gum commercial used to say. Jia, do you want to add to that?
After you finish.
I'll stop there because I could go on, and I'll give others airtime.
Hey, Jia.
Just a quick thing on the Delta variant, actually, where 2 doses is far superior to 1 dose. I was just on a call with the Ontario Ministry, and not everyone's been necessarily screening all COVID tests for variants of concerns, but they now see about a 50% Delta prevalence in the GTA. Which has been one of the hotspots, though no hotter than Calgary or Edmonton have been. Actually, we've actually had far more cases per capita than the worst Toronto's had to offer. And, they've gone from what they estimate to be about a 10% Delta variant load to 50%, and what they think might be 2 to 3 weeks.
Yeah. And
I think that, the Delta variant not only is more infectious, it's also more serious, leads to more hospitalizations, and we really do need those 2 doses. And so, our summer of fun is about to start, but it won't be a summer of fun if we have too much Delta floating around. So people really do need the 2 doses.
And I just want to pick up on the Delta variant piece, and I'd like any of you to expand on the distinction between disease, so having COVID and having severe COVID disease, and how vaccination, because we have all heard, and people would have seen the cover of the Calgary Herald on the weekend, describing the Foothills Hospital outbreak. Half of the 20-some people affected are vaccinated individuals. So underlining that, and some are doubly vaccinated, underlining that you can get COVID when you're vaccinated. Any comments about what the data show on likelihood of severe disease that might make you need to go to hospital for oxygen, or even, heaven forbid, need a ventilator? Cora, you've unmuted.
Okay, I'm so glad you asked this question, because I can tell everybody about the Alberta Health data that's available on their website, which is amazing, and you have to take a look at it because it just shows in real time how well this vaccine works. And we're like one of the 2 provinces showing this. And it's a bit of Albertan pride. We get put down a lot in this vaccine effort, and I just want you all to look at this. It's available on Alberta Health, and it tells you how effective the vaccine is in our province, and it tells you how it's effective on hospitalization. And they have these amazing graphs that show that over 93% of people in hospital right now are unvaccinated. And of the people who've had 1 dose, only 0.2% have COVID. So you can actually see this in our own province. It doesn't have to be something we learn from other countries, which is always good, and we want to learn, but we can see the effect in our own province, publicly available on Alberta Health website. This hospitalization and severity is also really crucial around the variants. So what they've noticed is that even though the vaccines seem to still work against most of these variants, against all disease, they seem to be a bit less effective. But against severe disease and hospitalization, we're still talking that 90 to 95% effectiveness, which is really what we're trying to do, right? We're trying to keep people out of hospitals, trying to keep people from ICUs, from death. So there's a lot of power in that against the variants, the protection, even with variants, the protection against severe disease is there in hospitalization. And it goes back to what I probably should have covered when you asked me about the AstraZeneca. And the reason all these vaccines were still authorized and were still so powerful is because they're very, very protective against severe disease and death. And in a lot of people who do see disease despite having had the vaccine, it's mild disease. Very different story than having to worry about your life and the threat it is to your life. Where we're seeing that maybe not have, and then we're also seeing that effect even in the immunocompromised people. So you know that if you're immunocompromised, if you have a blood cancer, if you have a solid organ transplant, if you have a solid cancer, you need that second dose way more than the average population because your protection bumps. But again, there's still protection against severity and death, which is really what we're all trying to prevent this virus from doing.
Thanks, Cora. And I did want to just comment on severe disease. One of the hats I wear is I'm an internal medicine physician, and I have provided COVID care. And I do want to underline that on that 1 in 55,000 person clotting risk, the prevalence of blood clots in people who actually have COVID is extraordinarily high. And many of the deaths associated with COVID are blood clotting deaths. So it's much like the pregnancy comment that Cora made, that if you're pregnant and you have COVID, the disease the likelihood of more severe disease is very high. Having COVID is not a good thing. It's just clearly stated, it is not a good thing. One other quick comment on vaccines work. There's also some interesting data on arriving travelers, and this is preliminary data that show that singly or doubly vaccinated individuals arriving at airports. There was a recent paper out of Doha, Qatar, where we have our nursing school, but also Alberta data showing that the likelihood of being positive for COVID when you have had 1 or 2 vaccines is exceedingly low, very, very low. So that's that theme that vaccines work. And now I want to go to the summer of fun because Jia invoked this. High level question, will vaccines deliver a summer of fun? And will being recipients of a vaccine permit greater freedoms? Will there be permissions to go to see the Calgary Flames play at the Saddle Dome in October, or to travel to the place I want to go to the US, to go to Europe? Yeah.
Yeah, no, yes to the first question. I mean, look, like vaccines will bring a summer of fun if people take the vaccines. We'll have enough vaccines really by the time the summer's over to really immunize more than everybody. But people need to get them, right? I was, again, on a little call with Alberta Health, and they're sitting on like 500,000 unused doses or something like that. I'm sure they're moving them quite quickly, but that's a lot, right? And we need those in people's arms as soon as possible, keeping in mind that it does take a few weeks for these vaccines to get into effect. So if you get vaccinated today, it doesn't mean you can start partying tomorrow. I mean, you can't party at all right now because we're still in phase 2. But, you know, at a macro level, the only thing that'll get us out of this is vaccines, all the things that have changed your life, right? Like every single one of them, we could go back to mostly normal if we have enough people to get into the vaccines. Now, when it comes to things people who are vaccinated are allowed to do and aren't allowed to do, you know, you look to the US CDC has really changed a lot of their guidelines around what vaccinated people are allowed to do. I think they've done that in large part, yes, because of the science, but also really to incentivize uptake, because the US plateaued at a much lower level than we did with first dose uptake. One of my jobs is I'm supposed to build vaccine passports for our country. I can assure you that getting vaccinated will be critical to you traveling to, well, pretty much anywhere but the United States, because they're more libertarian. When we're talking about Flames games, we're talking about other sort of events here, you know, more and more different organizations are going to mandate vaccination for certain things. You might have seen, well, you know, like with the Stampede, for example, I think we're going to mandate vaccinations in certain settings. And I think right now there's a certain discomfort to do that because things are all new and fresh. But, you know, I think that we all recognize that an event is safer, anything is safer if you have vaccines. And as the organizers of these events, whether that's traveling to another country, whether or not that's an indoor hockey game, you know, we think a lot about your safety, but also the safety of the people around you, right? And we want everybody to be safe. So if that's an incentive and that's a hook, there'll be more and more of these sort of soft vaccine mandates, certainly a hard one for a lot of international travel. And, you know, without getting vaccinated, it will be a lot harder to do a lot of things that we used to do that we really want to get back to as soon as we can.
Okay, thank you, Jia. Any comments, Sandra or Jon, from the standpoint of your students, students in healthcare fields and healthcare providers in terms of ability to move safely through clinical areas, interact with patients? And this is about both themselves, protecting themselves, but protecting others, and even perhaps a social accountability and a professional accountability. Sandra.
Well, I'd already unmuted because I was going to add something, but yeah, as I said in my opening comment, you know, we do have a professional responsibility with our code of ethics, as is similar to medicine, that we do no harm, that we take that professional responsibility to lead the way and be champions in things that we know and have evidence that support the health and well-being around the determinants of health. And so again, vaccines are very important. What we are finding is that from a clinical, you know, our nursing students are guests in the clinical settings that they go to. And all of our nursing students, for instance, do have a rotation in a long-term care facility. And because they are guests, the facilities rightly say students that are vaccinated are the only ones that can come in and have this experience in our facility, because they have a duty to maintain the safety of their staff and their clients. And so that's, again, pushing us as professionals and future professionals to take that very seriously and to have those vaccines. So I would say that the other thing that I just wanted to mention in terms of healthcare professionals getting the vaccines and having the 2 doses, you know, the pandemic has been raging on for 16 months now. And I was at a call with some of the nursing leadership from Alberta Health Services last week, and they're starting to see that a lot of healthcare providers that were exposed and actually had COVID early in the pandemic, before we had the vaccines, are experiencing symptoms of what you sometimes hear called long COVID. So just wanted to highlight that that's, as you said, Bill, having COVID is not good no matter how you look at it. But one of those things to consider is if you don't have the vaccinations and you do get COVID, one of those other potential long-term effects to your health, and that we're learning as we go through the pandemic and we have more and more evidence, is that there's these lingering health concerns related to having COVID itself that we're having to deal with as a system and as individuals.
Excellent. Jon, anything to add?
So I will just add very quickly, the situation is exactly the same for medical students. Our students can't travel and do electives unless they're there. And from a moral and ethical point of view, you need to be vaccinated. 100% of our students are vaccinated. And I would just point out, Bill, it's an interesting anomaly to me. It's an interesting thought experiment. There is a risk of hesitancy to vaccination amongst the public, all through Alberta, Canada. What's interesting to me is that when I look at physicians and medical students in Calgary or in any of the other study that we've done, these are the group that would probably know as much as anybody about vaccines, vaccine side effects. 100% of our students and faculty are vaccinated. That to me tells a whole lot, that the risk of the disease is a whole lot more than the risk of the vaccines.
Okay. I'm looking at the time and I want to squeeze in some content because we have so many great questions coming. Cora, I'd like to direct this to you. Just a quick answer on the intervals. Canada has taken an approach that emphasized first doses. So we abandoned the 3 to 4 week interval that the clinical trials recommended, and are near the top in the world in first doses administered. Now we have to do catch up on second doses. Many people are asking about what's the best interval. Do you have a sort of elevator answer?
Yeah, I think it's somewhere in between. So is everything. But I think somewhere around the 2 month period is probably the sweet spot of interval, because what you're trying to do is you're trying to get enough immune response, which we know, interestingly, with some vaccines, waiting 4 months gives you better immune response after that second dose. But you're also trying to balance not getting variants and not having fourth waves and other ones coming in. So needing to have that second dose, but having it at the right interval so you actually get really good immune response. I think it's somewhere around that 2 to 3 month mark, ideally 2 months with the Delta variant, just what it is right now in our country.
Okay. A question to all of you is, when many in the audience have actually asked a recurring question that I can paraphrase as follows: how can we speak to our vaccine hesitant or vaccine uncertain friends and family members? Do you have any high level recommendations? Anyone can take that.
Maybe I'll start it. And first of all, I want to say being a vaccine champion is more important than ever. All hands on deck right now. This is the wave that we need to ensure that we continue with so that we do reach those targets, and we can put this behind us. A few things. First, you have to connect before you can communicate. So make sure you have some kind of connection with that person. Otherwise, they're not going to buy into your message. Second of all, try to always to have real curiosity about where they're coming from on their hesitancy. So like you're trying to meet them where they're at, not where you want them to be at, but where they're at. And all the information you give to them has to be incredibly personalized to them. So don't talk about things that don't apply to them. Talk about how the vaccine in the context of their life is going to make a difference for them, because the vaccine hesitant come from a need for personal protection and personal benefit. So keep those in mind, these ideas in mind when you talk to them. So you may want to talk about how it's going to save the community, but that's not where the vaccine hesitant come from. They come from the need for personal protection and benefit.
Okay. And what I want to just, there were so many other comments, but I'll say one thing. A couple people posed questions or challenged the notion that one of the statements was, quote unquote, how can the medics say that vaccines are completely harmless? And I think what these experts have shared is that no, actually there are known harms and side effects, and these are being very carefully monitored, and the information is being disseminated with an unprecedented amount of openness and news outlets covering all the details. So we're in a new information era, but we are fortunate to have these vaccines. I'm just going to say in closing that the University of Calgary does have a position that vaccination is necessary and beneficial. And we are promoting vaccination for our University of Calgary community and beyond. And I like the question posed about having dialogue with your friends and family. And Cora, wonderful answer. We need vaccine champions. This is an important time. And for this summer of fun that we do want to have, that we do need for mental health, for economic activity, vaccines are a really important component. And so I feel so fortunate to have listened to all of you. What a wonderful panel. This session has been recorded. We will make sure that links to the session are available. Jia and Cora and Sandra are all involved in 19 to 0. We will save the chat function here, Jia, and we'll pass that on to 19 to 0 to perhaps give you extra information. The 19 to 0 website, by the way, is 19to0, so 19to0.ca. So go visit that site. Of course, you can also go to the Alberta Health Services site to book your vaccine if you haven't had a chance to do so yet. Thank you all, and thank you to our audience for participating. Thank you to the Office of Advancement for the logistics, the organization, and thank you to the community that has generated these vaccines. We are blessed to have this opportunity to be vaccinated and protected. Have a good day.
Thank you. Happy Tuesday.